Hi, my name is Fatma and I'm going to discuss macrovascular disease and diabetes. Diabetes is a chronic disease which results when the pancreas cannot produce enough insulin or the body cannot utilize the insulin produced. It is a global epidemic and the World Health Organization reports that the number of people with diabetes has risen from 108 million in 1980 to 422 million in 2014, and estimates that diabetes will be the 7th leading cause of death in 2030. But how does it present? While some patients are completely asymptomatic till the time of diagnosis, others can present with symptoms like increased thirst, increased urination, weight loss, at times increased appetite and blurred vision. However, as a result of persistently high blood sugars, diabetics are faced with consequences of microvascular and macrovascular complications. In macrovascular disease, large vessels in the body are affected by atherosclerosis, causing cardiovascular, cerebrovascular, and peripheral vascular disease. A little about the pathophysiology behind it. High blood sugars and insulin resistance seem to play a vital role in development of atherosclerosis and its associated complications. Current data and evidence suggest that metabolic abnormalities can lead to overproduction of reactive oxygen species, which in turn, through endothelial dysfunction and inflammation, contribute to diabetic vascular disease. The endothelium of the artery becomes more permeable, causing leakage of fatty material and depositing it underneath the intima. High blood pressure can cause further positive pressures inwards, and slowly the atheroma, which was initially tiny deposits or streaks, converts into large atheroma, resulting in complications like ischemia and atherosclerotic pathologies like myocardial infarction, stroke, or peripheral arterial disease. Diabetics, unfortunately, are at a 4 times increased risk of cardiovascular event. They are 5 times more likely to have their first MI and 2 times more likely to have a recurrent MI. Diabetes acts as an individual risk factor for cardiovascular disease, and unfortunately those diabetics who have any form of cardiovascular disease can have a worse prognosis than those who do not have diabetes. A lot of the times, patient could be completely asymptomatic, so at the time of diagnosis they could already have multivessel atherosclerosis, causing delays in treatment. Diabetics are unfortunately more prone to congestive cardiac failure, with multiple factors leading to dilated cardiomyopathy like severe coronary disease, high blood pressure, long periods of blood sugars, pre-existing microvascular disease, and autonomic neuropathy. It is estimated that 13% of diabetics greater than 65 years of age have had a stroke. So unfortunately, diabetics are at 2 to 4 times higher risk of stroke, with an increased risk of poor neurological outcome, including sudden and eventual death. But why? Once again, being a diabetic increases risk of severe carotid atherosclerosis and a carotid emboli, while in a non-diabetic might just lead to a TIA. In a diabetic, it can lead to irreversible brain damage. Now, like the carotid and the coronary arteries can have atherosclerosis, similarly, the lower limb vessels can also have atherosclerosis, resulting in peripheral arterial disease. Diabetics are unfortunately 15 times more likely to have a lower limb amputation, and while some can be completely asymptomatic, others can present with pain in the calf, buttock, and thigh, which comes on with walking and gets better at rest. However, in more severe cases, it can lead to limb-threatening signs of critical limb ischemia, in which patients can present with severe pain at rest, tissue loss, or gangrene. Now, what are the risk factors associated with macrovascular complications in diabetics? There are factors which are modifiable and we can help them, and then there are factors which are non-modifiable. The risk factors include genetics, gender, increasing age and duration of diabetes, cigarette smoking, carotid intima media thickness, dyslipidemia, high blood pressure, obesity, and decreased physical activity. The two famous Wikipedia study and Accord trial demonstrated either no impact or more negative macrovascular outcomes with intensive blood glucose control. So what can we do to help? The Steno study pointed out a more positive cardiovascular outcome can be multifactorial rather than just secondary to glycemic control. So keeping this in mind, we need to have a more holistic approach in managing diabetes with both lifestyle and behavioral interventions like increased physical activity, better diet, and quitting smoking for better macrovascular outcomes. Thank you.